Lighten your load with AI. Let's talk about AI because I know everyone's itching to talk about AI. So I did a presentation not too long ago, actually for a law firm that's focused on health tech. The gentleman before me, who was the keynote, not a doctor, came up with a robot. And he did an entire presentation. Let's call this robot R2-D2. Everyone know R2-D2? OK. So he brings up R2-D2, and he does this whole presentation, similar to mine, talks about burnout, talks about the dysfunction in the industry, talks about the forest, and says the solution is R2-D2. The solution to burnt out doctors and physicians is that we need robots who are totally autonomous. They're AI-operated, AI in and out, AI brains. They can practice medicine and do it better. They can replace this workforce that's going downhill. So I was polite. I followed this gentleman's presentation. And I asked everyone in the room, and I'm going to ask all of you, anyone been out to California? Anyone in California with the autonomous vehicles? Right? How many of you are parents? I also have an 11-year-old. How many of you are putting your child in the autonomous vehicle to drive to school? Now, how many of you would send your kid to school in a vehicle, I'm just saying school, but wherever, right? In a vehicle that was operated by a human, but had AI features, safety features? Sounds pretty safe. Sounds safer than the human eye or touch, right? Healthcare is no different. One mistake costs a life or an irreversible side effect. So we talked about R2-D2, and that was my leading question, and everyone had the same reaction, like, heck no, I'm not putting my kid in that car. So why would you let R2-D2 do mom's surgery? Why would you let R2-D2 manage your diabetes? The answer is very simple. You would not. Now, if R2-D2 was in the background, if R2-D2 made the doctor smarter, more efficient, helped the nurse get their administrative tasks done, you would say, now that makes sense, right? Because no one's signing up or making an appointment to go see a robot. Why? Because they trust their doctor. They do not trust R2-D2. So when we talk about AI, when we talk about ChatGPT, when we talk about generative AI, throwing all the acronyms out there, there's a lot we have left to learn. And it doesn't mean there's not an enormous opportunity, because there is. It's really dry in Arizona. Thanks. So the point is, as you think about AI, focus on the forest, not the trees. So we have burnt out doctors. We have burnt out nurses. How do we decrease their administrative burden? It's simple things. Prior authorization. It's unfortunate we don't have more doctors in the room. We hate prior authorization. It takes so much time, and it is so manual. Why don't you automate that? Studies have shown that a manual prior authorization is about $4 a pop. An automated prior auth is 4 cents a pop. I feel like Blue Cross should look at that, right? It just makes sense. Also, no one knows everything. As smart and as long as it took to become a doctor, you can't possibly know everything all the time. So clinical decision support, offering tools at the bedside that action up the latest studies, that action up queries that I might have when I have a lupus patient in front of me is very helpful, right? Diagnoses, being able to make better diagnoses, being able to decrease burden, and documentation. Everyone's heard of pajama time, right? That's the time the doctors go home after their workday to actually document all of their charts. AI can help with that. This is the low-hanging fruit that can change healthcare. Keep R2-D2 in the closet. He's not the answers. You guys with me? $360 billion of savings is projected if AI is used intentionally and correctly. Virtual care. How many people have done a telemedicine visit at some point in the past 3 years? How was it? Good? Convenient? Easier than sitting in traffic? Easier than waiting 3 hours in the waiting room, easier than taking the day off. So make the connections matter. We are finally in a post-pandemic world where we realize doctors can do it, patients want it. We have to keep it going. But remember, virtual care doesn't just mean a video visit. It means texting. It means a portal. It means connecting it ideally to connected devices. How many people have one of these watches or one of the rings, have smart devices? There's so much information. How great to make an intervention when your heart rate is going up, when your heart rate is going down. Connect it. Make it meaningful. We can test everything now, mental health, heart rate. It's unbelievable where the industry has come, but we have to connect the dots. Very important to connect the dots. Atrium Health signed an amazing deal with Best Buy. They have done this really well. They have used connected devices combined with virtual care to follow CHF patients, and they've actually reduced readmissions by 40%, simply with a phone call and monitoring your heart rate 3 days after discharge for a CHF exacerbation. That's doing more with less. That is what properly implemented digital transformation looks like. Elevate online engagement. I don't know why in healthcare marketing is a bad word. Marketing is thought to be evil. Well, guess what? Everyone's on social media. Everyone's on TikTok. Anyone seen those cool videos on TikTok with the doctors doing their snazzy dances? People remember that. It's relatable. It's reachable. We have to, as a healthcare industry, embrace marketing and communications with digital transformation, because at the end of every misinformation train is the emergency room and the doctor that has to clean it up. And it's very expensive and often irreversible. So making this normal, understanding that marketing in healthcare is patient education, and social media is just it's just one more tool. It's not academic. It's not viewed as academic. Well, there's a difference between academics and reality. And we all live in reality. So the answer. What is the answer? The answer is in this room. The answer is everyone in this room that went into healthcare for a reason. You guys don't make garage openers, right? What you do matters. Remember that purpose. Remember why you chose healthcare. Remember why you chose FEP to be a part of. 5.5 million lives. You touch 5.5 million lives. You should be so excited when you get up in the morning that you have a job with purpose. Don't miss the forest for the trees. Focus and remember that burnout is real. Remember what the consumer wants, which is convenience, affordability, relatability, accessibility, and transparency. And ultimately, your job is to keep the trust between the patient and the doctor so they actually get the mammogram, so they actually come in to make an office visit. And if they can't, there should be a virtual solution to do that. And we must remember our underserved communities. We are all connected. If there's anything we need to remember from COVID, it's that we're only the strongest as the weakest among us. The underserved is part of this equation, and digital transformation can help the underserved in a way that wasn't possible before. I'll tell you, as a rheumatologist, I frequently get calls from the Midwest because there's a limited number of rheumatologists, always asking for a second opinion, always asking if I can look at a rash. We have to scale that. We have to help one another, not just because it's the right thing to do, but it's how you do more with less.